and we help you. We pick you up from the airport. We take you to the hotel, and then our private transportation. We're going to pick you up again to take you to the office. So my main plan is never leave you guys alone. Right? It's okay. I got you. You only you're actually going to have like your mobile. Like if you don't have the right connection, we give you something to be in constant contact every time. Um, and why it's so popular right now coming to Costa Rica to do your dentistry is because we're really pretty awesome. We're really great. Uh, I'll go back and forth to states, to capacitations, to Congress, to be. Actually, we were in the New York National Dental, and that last year was. Um, the tech is pretty much the same. We buy from the same guys. Our porcelain and zirconium and every single procedure is pretty much the same. Same brand of implants, same bone grafts. So we're really excited. So about doing what we do right here because when we're not only helping a lot of people who just can't afford to go to their homes and just do all the dental plans because the insurance is actually is not going to cover it, right? So they come here and we help you to the with the bleachings, with the veneers because I want to really start smiling again. Um, I want dental implants, and it's just ridiculous the amount of dollars it costs in the states. And when it's $6,000 each in states, and how much is it? When really? Okay, so this is the difference of the price is really one of the main reasons why people come here. Okay, and we're really I'm really excited because the cosmetic and restorative part is my part, so it's where I get really excited when I see sad faces and people who just don't smile very often and they don't look really happy in barbecues on Sundays because they're not able to have their really big steak or the corn or just like smiling like yeah I know what you mean, right? So and they get out of my office just with that smile again. That is one of the most beautiful and amazing reasons why I become a dentist. It's because you get to change lives one smile at a time, right? And people, even some people, they say like, "Oh, my liver is more important." I know. I mean, you have. I mean, I know their medical issues more important than just a good appearance. But even though it's actually really well known that if you don't have a very healthy oral situation, it can become something really more important and in your metabolism it can the bacteria can go through your heart, it can go and be more make more damage than you actually think. Okay, so here we go. Now that you're looking for a home, this is a beautiful paradise, but you already know that. I now you can, I think we have a few pictures from Costa Rica. We have worldwide dentistry. You can go to the other one. Yeah. Oh, okay, good. Worldwide quality dentistry while you're on vacation. This is pretty much what you can do because we help you. Okay, I want to do patients actually from ARCR. ARCR. That's how you call it. Okay. Now we have a lot of patients from you. They go come. Okay, I want to help. I want to fix this and this and this, and now they come back in February, do veneers or implants, or all on four. If you don't know what that means, is complete dentures based on 4 or 6 or 7 or more implants. Okay, no more like sneezing and your denture going away in front of your aunt. Okay. Well, this is a few changes. This is one of the main reasons why people just like veneers or like implants. It's because you get to smile again, right? Now that it's about what is an implant? Implant is a titanium abutment that goes inside your bone and it stays there for how long? It's a lifetime guarantee. Doctor, can you say lifetime guarantee? Yes, I can say. Okay, the osteoplant, the osteo integration in your bone, it gives me the security to tell you guys they sit there forever. And then you go now. That's the part that goes inside the bone. The clinical part is just you need to be checking that. The crown is. It looks super painful, right? But it's not. Okay, there's full now. This patient right here just have one, two, three, four, maybe five implants underneath, and he is gonna be able. Well, I don't know what we have chicharrones here in Costa Rica. I don't know what that means, but I don't know what do you have in the states that's really, really strong to eat. What could be strips? Yeah, right. So you can eat whatever, like when you were 15. Okay? Doesn't matter what you want to eat, you can eat whatever. Whatever, doctor? Yes, it is. You can eat whatever. Actually, we made a test. Okay, we do all in four upper and lower arch. Can I have an apple? Yeah, you will. And then you have that apple, and then you crunch it with those. Actually, have to be careful because most of the times you've been losing teeth for such a long time that now you don't feel confident biting that hard again, right? Good, like, can I do it? Okay, yes, you can. You can do that again. And remove bad and old technology. The technology we use nowadays is really, really something else. Scanners. I don't know if you guys remember when you go to the dentist and then it's the 45 seconds more terrible in your life because you have to wait and start breathing through your nose and okay, I'm not going to throw up in front of this guy. Okay, now we have scanners and um, and 3D dimensions and to make smile designs, which is pretty awesome. We do everything by the computer. And some of my beautiful patients go back and forth from the States and going back home with beautiful smiles. Okay. We also work with Invisalign. Invisalign, it's like orthodontic treatment without using the braces. It's like they actually are quite invisible, transparent, and you put it on the lower and upper and lower arch, and then accommodate your teeth again. It's not for every patient, but if you want to try, if you want to ask, if now we're gonna have any questions you need or you want to know. Yes. Yes. Yeah. 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 Well, that's one of the most regular problems. And in the States, for each and every single procedure, they're going to charge you whatever. Sometimes they want to charge you again for the same price and everything all over again. With the dental implant, if it doesn't work right here in Costa Rica, at least in my practice, in our practice, if something happened, we replace the dental implant because it's our guarantee. Okay? No, no, no. The implant. The implant. The post is still in there. So it's just the crown, the white part who fell off. Yeah, yeah. So that's just it's a crown. To just put it again. Well, I will lovely to help you to see his case. Okay. Um, Now is no, pearl is not your bite. Pearl right now is the adjustment of the crown in the actually titanium. So what you do is the scanner. You do a scanner again, and then you put the crown all over and just fix it once for all. Okay. And we're here in Escazú. Okay. Bueno, we're here in San Jose. And we're really, really, really close. Actually, the patients we have from ARCR, we pick them up and we take them to the office. We were going to be, I don't know how many days they're going to stay here. How many days they're going to stay here? Until Monday. Okay. For each and every single of you, we're going to give you a free consultation for our any of our DDS for any consultation you want to see in private. Okay, it's going to be free for just our convenient treatment. That's me with more makeup, and it will be lovely to have any of your questions. You have any other question about anything? Yeah. Yep, back and forth. Yeah. It's actually cheaper. It's actually cheaper if you do that than having it in the States. You go back and forth, you then come back here and we do the second phase because remember with implants you do two phases. It's you place the implants in the bone and they have to wait, right, for at least 5, 6 months, and then you come back for the other for the other part with the other rehab, and then you come back and then we do the other procedure. And it's not that you're not gonna see me again. So we still keep zooming or watching, talk about the phone, everything is good. It's not, this is really important because most of my patients tells me, okay, what happened if you do that to me? And I'm really happy about the procedure and everything went great. But what about if I wanna do a checkup and I'm not gonna keep coming every single month or every 6 months because now I have everything done. You can go to your dentist. You go to your dentist. I actually have a few and a lot of other dentists, Miami and New York, New Jersey, or any other parts. But even if I don't have a colleague that I can call, you can definitely go there and just, okay, just I have this and this and this, and you go, Dr. Carol, or Nature's Smile Doctors, I want my, how do you call it, my file or whatever I need, my X-rays, whatever. We send it to you, and we tell them what we did, how we did it, and with what materials, and we talk with your dentist. Okay.
Okay, the normal question is why is such a price difference? That's that regular, healthy, normal question. So who's gonna answer? Okay, gonna answer it for you guys. Very simple. A a orthodontic, um, a dental orthodontic doctor will graduate. That's the one that puts your braces on. Will get a loan from the bank, which they get almost automatically because it's a very profitable career, and they'll be between 1.5 and 3 million in the hole the first day they start working. They have, as long as they're in a place where there's enough population and there's not too many specialists of their same career, they will make that money back. The bank will make sure that they make their money back. But why is it so expensive? Schooling has gone a little bit. I'm not criticizing your country. I'm stating facts for you guys to understand. The tap water here is safe to drink in the whole country. In other countries, it's not that safe to drink. You just ask why, and it's because of there's not enough plants to treat it. It's a factual thing, right? So schooling has increased almost 300% from when some of you guys probably graduated, and also since what we talked before, employers take out dental from the regularly issued policies, so that leaves it completely to a free market. And you add on to that two issues. One, you are a very litigious country with immense payouts, right? I'm sure you are aware how the rest of the world sees that because there's a big discrepancy. If a bus runs me over and breaks my foot, the bus company pays for my surgery and pays for the days I'm not working and everything else, but I don't get a $15 million payout when I can go and play soccer again, but and still get a 15 million payout, right? So that litigious nature of service-based practices makes it so that they have to cover themselves for that. So the ones they pay, not the ones you guys pay, the ones that they as dental practitioners have to pay. So brass tacks, what's the difference? About 60 to 40%. So if you're catching a plane and enjoying the beach and going to the volcanoes and staying for 7 to 10 days here, have a mini vacation, and you total it up, you're still coming up ahead by visiting us, right? And the other thing that my wife is humbled about talking is we cater specifically to people who need a lot of work done in a shorter amount of time, right? Your dentist, I'm busy. I got tea at 4. So how about we do this on Thursday, right? This is very common. Mm. Like, like, yes, basically the partnership model that I talked to you about in Toucan, that was not completely my idea. That was basically what she does. She's the clinical director. So what does she do? She sits down with you guys or with someone from Guanacaste, which is the northernmost part of the country. They'll come here and say like, I want to visit because you have all the technology and we have good things for you, and we come up with a plan. And she'll call the best implantologists and the best maxillofacial surgeons, and they'll come up with a plan. They'll work it. We don't need to maximize every procedure. We don't actually perform it. When I say we, it's her hands, right? What she does is she finds the best person for what you need. So there's not a single root canal that she's performed. All root canals that are done in Nature's Smile is by an endodontist, someone who went to dental school and then specialized in root canals. That's all she does, all day, every day, all around the country. She only works for 4 clinics. We're one of the lucky ones. So Carol doesn't do every procedure. She doesn't do every surgery.
And then that gives the patient that part when you start feeling that, okay, this is actually working. Because each and every single specialist, when you go to a general doctor and you start saying, like, okay, I feel stomach pain, but if you go to the specialist in stomach, he's going to tell you a lot of different things, and he's going to help you right through it because that's what he do every day, right? And that's what happened with my husband when we were with his arm. We started talking with another people with orthopedic. How do you call that? And orthopedic surgeons. And then the thing I called to the States and to talk with this guy in the States, and he said, this is Dr. Yao, and he was performing in Stanford. And he said, what I only do arm procedures. So it's only arms. So can you imagine how good he is performing arm surgeries each and every single day? and he got space for like for 6 months. When I first called him, he was okay. I have space for you. Have to get in line. I need 6 months so I can perform. So that's a good call in medicine or in science. You go with the people who knows what they're doing, right? Any other questions? You okay? That's it. Well, it was a pleasure to meet you. You have anything else? Good. You're ready for a coffee?